Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls at what number, Dr. Darrow?
866-870-5752. I'll repeat, 866-870-5752. And if you're too shy to call, go to the website, www.lastemcells.com. If you want to talk to me at the office or get more information that we forgot to talk about on the show, you can call my office. There are people by the phones at 800-300-9300. The office again is 800-300-9300. If you do call me right now on the radio at 866-870-5752, I'm going to send you a copy of my free book. Actually, it's not a free book, but it'll be free for you. $25 book. A couple hundred pages long with studies, 250 studies or so. Let me look. 264 studies, scientific studies that are peer-reviewed on how platelets and stem cells, PRP and stem cells, help heal the body by just injections without surgery. And there's studies in here that show why surgery is very typically for musculoskeletal pain unnecessary and not really good for you. Now, this is not a statement against surgeons, who I think are the hardest working people in medicine. They've got a real tough job, and I don't think, personally, my own humble opinion, they should be doing all the surgeries they are doing. And many times they do surgeries based on an image that they take when it's not even the cause of the person's pain. So I was being trained in orthopedic surgery, and at the time, I thought it was the only way to heal. And after my own shoulder surgery that went bad, I'm not blaming the surgeon, it's just what happens, human error, whatever. I turned out not very good after that surgery, lots of pain and misery for years, until I discovered regenerative medicine using platelets and stem cells. Actually, it was other stuff back in the old days, but it's much more efficient now. The injections are much better. And since then, I've been doing this work for 25 years now, and I am busy every day, and I love the work. I love watching people heal. People say, "What do you do, Mark," when they meet me at a party? I go, "I watch people heal," because it's a great life. I want to get back to Milan, who just called up a little while ago. So, Milan, I know you're listening still. Milan came in with very advanced arthritis, and I know this because I'm in front of a computer right now also, and there's only one patient. I looked up on my electronic records. There's only one patient I have with the first name Milan out of like 20,000 patients, so I got lucky. So I found his chart, and Milan, what you did is you had 2 PRP injections, and you got a lot better, and that's pretty amazing considered based on your examination, with the pain you were having, and based on your x-ray. You have advanced arthritis in the shoulder, and I injected the joint under ultrasound guidance. I did your infraspinatus of the rotator cuff, supraspinatus, subscapularis, and your subdeltoid bursa. When you came back, you were much better. Now, you mentioned when you called the show that you're going to Kaiser to get a shot on Monday. I'm going to tell you not to do that, okay? You're my patient. I can talk to you like this. If it's someone else on the radio who just calls in, they're not my patient, I'm not going to talk to them like this. But my suggestion, Milan, is you come back in the office and talk to me. I don't charge for follow-up visits. And as you know, probably the phone number to the office is 800-300-9300. I would suggest you do not go to Kaiser to get a shot. I would suggest you come to my office and talk to me. It won't cost you a nickel. And they're probably going to give you a steroid shot in your shoulder. That's typically called cortisone. If any folks listening want to right now Google cortisone and the other word cartilage, put those two words in, you're not going to want to get a cortisone shot anymore because you're going to see that it destroys the cartilage that you have left. And Milan, you don't have a lot of cartilage left there, so I don't know why you would want to kill the rest of it. It'll feel good for a short period of time. That's what the cortisone shots do. They're very strong anti-inflammatories. But it's like winning the battle and losing the war. In the long term, it's not going to make you happy, and you're going to have more pain afterwards down the road than you are having right now. So please, 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 Milan, come into the office and let me talk to you, okay? I'm not going to charge you to come in.
Okay, shall we talk to Hugh in Irvine?
Hugh, Dr. Marc Darrow, I understand that you've got neck stuff going on. What happened to you?
I am suffering from a C3 to C7 1 millimeter protrusion in my neck area.
Okay.
I've seen a orthopedic surgeon. He says that's basically from stenosis.
Okay.
They've already given me one injection shot, a steroid shot that you were just talking about.
Okay.
Which
so
lasted
you probably had you probably had what's called an epidural.
Yes.
Okay. And did that give you a lot of relief, I hope?
No, it only lasted for about half of a day.
Okay. So that's good news.
So
don't you have a big question like, why is that good news?
Why?
Because that's not the problem that they told you it is. If it were, that injection of the steroid, cortisone, whatever you called it, would have been better. It made you better, not just a half a day. The half a day worth of getting better was probably the lidocaine that's mixed with it, which is a local anesthetic. So, do you have arm pain or just neck pain?
Actually, I have arm pain all the way down to my hand.
Okay. And which is worse, your neck pain or your arm pain?
The arm pain, actually.
Okay. Have you ever tried spinal decompression, where you go to a chiropractor, an MD that's got a machine that stretches your neck?
Yes.
And how did that go?
I went well for maybe a session or two, but the feeling of that, I guess it's called pinching, just came right back, actually.
Okay. How many treatments did you do?
Only 2.
Okay. Well, that's a failure on your part. Okay. Because I've seen people, I don't do it in my office, so I don't have a dog in the fight. But I'm just telling you, I've seen endless people that have what looks like a radiculopathy, that means the pain down the arm or legs, go away with spinal decompression. It doesn't have to be an expensive procedure. Some guys have these very fancy machines they use, and they'll charge you $5,000 or $10,000 to do that. You don't need to do that. You can go to someone that has a decompression table, and it's very inexpensive. So it worked a little bit. I would say go back and do that again. Now, the big deal is this. The studies show that 94% of people that have that kind of thing down the arm or down the legs, that goes away by itself without doctors. All right? So if you're having neck pain, I can help get rid of that. And sometimes when I do that, the arm or leg pain will go away.
Well, the neck pain is where it starts at, but most of the day my arm is the part that is throbbing and tingling and getting numb.
Well, Hugh, I'd have to examine you. This is not based on an MRI or based on an X-ray that I treat people. I base on touching them, getting their history, moving them around, and very often I can find the spot that is the pain generator. Not always, but most of the time I can tell people in about 1 minute what's going on after I touch the body, wherever it is. I don't care what part of the body it is. I don't diagnose based on MRIs or other images. I like to have them because it's good ancillary information. And once in a while, we'll find a tumor or something like that that has to be removed. You can have a tumor that's sitting on a nerve. You can have cancer. You can have all kinds of things. So I always like to get an image, but I don't treat based on that image. I treat based on my examination. The image is a backup for me.
Okay.
Is all this making sense to you?
Yes.
Okay. And having a 1 millimeter protrusion doesn't necessarily mean anything. Having spinal stenosis, all these things that show up on MRIs doesn't necessarily mean a thing. We find this on people that have no pain too when we do studies. We go, hey, you got a protrusion. Hey, you got stenosis. And they go, get away from me. I'm fine. Don't touch me. I don't need any treatment. Don't confuse the two. And do not get a surgery until you go to a doctor who does what I do, who uses their hands and techniques for healing that are non-surgical. We see way too many surgical failures. I hate to talk about this on the show, but Nita and I, about 2 years ago, had a woman named Kathleen that called up, and she was crying and said, what happened to my husband? I said, I don't know what happened. She said he just came out of a neck surgery on a ventilator, a breathing machine. And I said, why are you asking me what happened? Why didn't you ask the surgeon? She said, I didn't have a chance. He came out to the waiting room, said everything. He said, I did everything perfect, and walked out. And that poor woman, husband, died from a simple, quote, simple neck surgery. I've seen way too many failures with these. It's not against the surgeon, I'm saying this. I love the surgeons, I just don't like the surgeries. And if you can get away with a conservative treatment in medicine, I don't care what it is. I don't care what part of the body, what disease, whatever it is. If you can heal it naturally, please try that first, unless it's an emergency. If you got a bone sticking out of the skin, you better get to the surgeon in 1 minute. But most of the stuff, do conservative treatment. Don't go to invasive things when you can do conservative things. Now that makes sense to you, doesn't it, Hugh?
Yeah. Now, the treatments that you've been providing over all these years on what you talk about on the show, the stem cell injections and the plasma injections.
You can talk a little bit louder, please. I can't quite hear you.
Now, with your the work that you do for stem cell injections and plasma injections, do you recommend
it's platelet injections, PRP, platelet-rich plasma. Both of those things are mixed together. Yeah. What about it?
Is that something that you think it may be viable for something?
Well, for the neck pain, I think so. The arm pain, I have to check out and see where that's coming from. There are referral patterns from the neck down the arms and from the low back down the legs. And in acupuncture terms, we call them meridians. And in one of my books, it shows these patterns. And when you sometimes fix the initial area in the neck or the low back, these referral patterns go away. So the arm numbness or paresthesia or pain, tingling, can go away. And same with the leg. But sometimes it's a true radiculopathy, where the nerve is just being pinched so terribly that surgery is necessary. But it's not something you just jump into. You always should get an EMG and a nerve conduction study first before any of those surgeries to see if it really is a nerve impingement versus a referral pattern. And unfortunately, I rarely ever see these studies being done anymore. When I first started in my career in medicine, every surgeon would get these studies first. Now they don't. Now they rely on images and they end up with failures. I don't know why. They also used to give a psychological test called the MMPI, Minnesota Multiphasic Personality Inventory. And that'll show you if you're a good candidate for surgery. Some people are not good candidates for surgery. I am one of them. I had to take that test in medical school. It was something we all had to do to see what it was. And I'm in the category that does not do well with surgery. And to wit, I had a shoulder surgery that went bad. Surgery doesn't work good on me. and it doesn't work good on a lot of people. So we got to be careful. Surgery is invasive. It can cause infections. People can die. Okay? I don't like surgery. If it's got to be done, it's got to be done. But most of the time, there's other things that can be done. Okay?
All right. Thank you so much for your time.
You're welcome. If you want to call the office, the phone number there is 800-300-9300. And if you want to go to the website and watch me do these injections, there's videos. It's www.lastemcells.com. A lot of the people that come in will say, why are you so adamant and so certain of yourself? And I go, I'm not. I've just been doing this 25 years, and I've seen the goodness in it. I've seen how it works. Am I certain it's going to work on you? No. You can't. No doctor should guarantee anything. Never. And I have people sign a waiver, a consent form, where they write it out, but with their own handwriting, saying, I understand there's no guarantees, and this may not work. And if it's going to work, you may need a few treatments. People always say, why do you make me write it out? Because people don't read consent forms. They don't.
That's true.
I don't even read them when I go to it. And I'm a lawyer, too. You know, I'm used to reading every word in a 50-page contract. But when it comes to walking in a doctor's office, I know I've got to sign that consent, and it's in small font, so I can't read it anyway, and I just sign it. I go, forget it, I'll sign it. You know, I'll take my chances. When you come into my office, I have large font, and I make people read it, and I make people write things out. Why? Does that help me legally? No. Courts don't like consent forms. I want people to know of the potential problems that happen when they see a doctor. Seeing doctors is dangerous business, okay? And sometimes I laugh with the patient. I go, you're better off not even coming to see me. If you can handle this conservatively by yourself, that's the best way to heal. And there's enough information on Google today, on the internet, to see how to heal things naturally without doctors. I'm not saying that's going to work all the time. Nothing works all the time. But when you blow into a surgery, that's a major deal. And you better do your homework before you do that, unless, like I say, it's an emergency.
Thank you for your call, Hugh.
Hugh, God bless you, man. I hope you heal up. And I hope you heal up without a doctor, because there's a good chance you can. So we're going to go to Anthony. Anthony, it says here...
Yes, sir. Thank you, doctor.
You had back
I've got
surgery?
a terrible story about people getting ladders put in their back because of back injuries. And I think it's a certain way to cause suicide, like my brother did. His failed. He had the ladder removed, and it was even worse, which led to his suicide. So when I found out two other ladies had ladders put in their back, I said, my God, I wish I had known about this ahead of time. You should have gotten relief by other means. And they said, how? And I said, well, there is a Dr. Darrow on radio I am going to contact about this. Those ladders cause death. You might as well be put up on the cross. They are just practicing physicians. I said, I'm going to call Dr. Darrow and see what he thinks about getting stem cells to help rejuvenate the back. That's my first question.
Well,
Let's
first of
go
all,
out after that.
Anthony, I cannot tell you what this means to me that you called.
Well, the back of the ladder in the back. That's
I'm
what
so
I'm
sorry
wondering
about
Is
your.
there
I'm
any-
so sorry about your brother.
I'm sorry
Yeah,
about your
well-
brother, too. That's terrible.
I'm sorry. I get emotional about these things.
Yeah, we do.
I hear the worst
Yep.
stories
Me too.
that happen from surgery, and people say, "Why are you so against surgery?" I'm against surgery
of that.
because people end up like that. And I'm not blaming the surgeons, it's the culture that they grow up in. And I grew up in that culture. I wanted to do orthopedic surgery so badly. I loved it. I loved the work.
Yeah.
And then I saw what it did to people. And look, there's a lot of good outcomes, and there's a lot of great surgeons. And unfortunately, there's too many surgeons that I'm going to call so stuck in the culture of surgery that they can't see the daylight of healing with other methodologies.
Yes.
And
in
I
other words,
can't-
there's no help for these ladies that have the ladder in their back at this time.
No, that's not true. That's not true.
Oh, good.
I have tons of patients who have spinal fusions, and that's what I
Yes.
think you're talking about, where they put metal or take the bone from the pelvis and create a fusion, who have done very
Yes.
well, very, very well with my treatment. And I'm not a fan of these
Excellent.
fusions, and even so with that, there are many times I can help, okay? And I
Yes, this
can't,
one lady said she got a spinal cell infusion in her back, and for 1 week she had relief. Then it went right back again to pain. Now, did she stop too soon after only one shot?
well, that's one of the biggest failures is people stopping. I
That's
can't
what
tell
I'm
you how many.
afraid of.
Yeah, I can't tell you
You
how many
should have kept
treatments it's
going.
going to take. I mean, the idea is the body is growing the tissue. I'm just stimulating the tissue to grow, and it depends on the patient. The biggest failure rate in my work of injecting stem cells or platelets is the failure on the
Yes.
patient's part, where they're
To
either
follow up.
to follow up. Yeah, either too active.
Okay.
Yeah.
In other words, they've got hope. Well, my second question is myself. I had a knee replaced, and after about a month, I was getting pain in the leg, and went back to see the doctor after a lot of physical therapy, and he said, "You have a cracked tibia." "How did you crack your tibia?" I said, "I do not. I've endured a lot of pain during the physical therapy where they bend your leg all the time. Maybe that's what did it. I don't know. I'm wondering if a stem cell injection would help heal the crack in my tibia."
Well, first of
On
all,
my
how do you think the fracture occurred?
I really don't know. It hurt a month. It hurt from the very beginning since the operation, although the x-rays did not show any crack in the tibia after he had done it. They take many x-rays, of course.
Okay, let me tell you something, Anthony. Fractures don't show up in x-rays right away sometimes unless it's displaced. Displaced
Ouch.
meaning the bone is separated. When it shows up in
Ouch.
an x-ray, if it's not displaced, is after about 4 to 8 weeks when the bone starts regrowing. You
Yes.
see some sclerosis. So I'm not going to tell you how that fracture happened. You can use your own mind to figure that one out.
Right. Well, I have osteoarthritis. I wonder if that might have helped. You know, weak bones, they might have had a break.
Well, what's
I
your
don't know
what's
if
your
you
age?
noticed.
What's your age, Anthony?
82.
Okay. At 82, unless you're supplementing with testosterone, the chances are you have osteoporosis.
Right, I've got it. I've
Yeah.
got it.
Right. So I put my patients on testosterone when they need it to alleviate that.
Ay.
Oh, I'm so
Oh,
sorry we are
Anthony,
out of
we got
time.
to run, man. I'm sorry. Call the office to get a hold of me. I want to talk to you some more at 800-300-9300. And I do want to talk to you, Anthony. I think there's stuff we can do to help you. And I think we can help that leg pain and the fracture that you have, okay?
Okay,
So-
we got to go. Thank you, Dr. Darrow, Katie, and Suzette. We'll
and
see
God
you next
bless you
time.
all. Thank you.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.